Action.
I'm Emma.
And I'm Angela.
And today we are going to be focusing on healthcare. Today we are going to be interviewing an employee of McKesson Healthcare. And our focus question is, what makes healthcare markets inefficient? Stop it. Or not. Our guest over here, her name is Alexa. Okay, so Alexa, tell us, what is McKesson?
McKesson is a national company that specializes in setting up the electronic data exchange between the healthcare provider, meaning the hospital or the doctors, and the insurance companies.
Thank you.
Why did you choose to work for McKesson?
I chose it because I have 20 years in the healthcare industry experience, and I wanted to work for someplace that was local, where I thought I could give them some knowledge of my background and help make the process more efficient here locally.
Okay, now to get into some inefficiencies that we have been researching. How much do you charge for healthcare services, and is it too expensive for some people?
So the prices of insurance is a contractual agreement between the hospitals and the doctors and the insurance carriers. So those prices are determined between the two of them. They sign an agreement, and that's what gets charged to the patients. That's what's determining the price of the cost of insurance. So there are many, many patients who can't afford to see the doctor because they know they can't afford the out-of-pocket costs, and they can't afford the insurance to buy it either.
It's very unfortunate.
So what kind of problems can happen from the medical billing to patients?
So oftentimes what happens is the patient gets charged for services that maybe they didn't receive, or they get charged a higher price because it's not the contractual agreed amount between the doctor and the patient. It can be because the patient doesn't have insurance and they get charged a certain dollar amount. So there are a lot of problems on the billing side that can go wrong that could ultimately affect the outcome for the patient.
So why would you, or what would you say is the main reason people come to McKesson instead of others? Is it because around here it's local, or what?
Well, McKesson, it is nationwide. However, the local office here, we work primarily with hospitals and physician services in the New York area. Okay. So the hospitals in New York oftentimes choose McKesson because we work out of New York.
Okay.
So now to get into the vibe of the office, does the local McKesson office treat its employees well? Does this affect the patients and or doctors' offices?
So I would say if you were to poll the employees of McKesson in general, I would say it has a very high percentage of people who are unhappy with the work environment. It's not necessarily a positive environment. The morale is low, and ultimately when that happens with the employees, it then affects the works that gets sent on for the hospitals and the doctors, because there's inefficiencies because the employees are leaving sooner, so they're not as experienced, so work isn't getting done as quickly as the hospitals would like, and overall it causes all sorts of conflict.
Interesting. So, is there beef at your office?
Yes, there's definitely tension. There's disharmony between the management and the employees, which again leads to poor morale, which affects the outcome of the product, which then affects the client. So in general, the vibe is not positive.
So would you say that's mostly because of management then?
Absolutely. It comes from the higher up and works its way down, and management is not changing anytime soon.
So, we heard around town that you might have quit. Is this true?
It is true. About a month ago, I decided to leave. Ultimately, I had the same issues that other employees were having, and that was trying to make things better, was trying to work with management to improve the way things were going on certain teams for certain hospitals, and it wasn't going anywhere. And after 2 years, I knew that it wasn't going to change. So in the end, for me to stay there wouldn't have been positive for either side. So I decided to leave.
So while you were working at McKesson, were there any kind of shady business strategies that were used that you know of?
I don't know about shady, but there were certainly things that were expected from our clients, the hospitals and doctors, that weren't getting done because of the high employee turnover, because of the lack of direction from management, and the mismanagement of our resources. There were huge projects that didn't get done. Therefore, ultimately, the hospital loses money because of our lack of efficiency.
So overall, would you say that the local McKesson is an efficient business?
I would not. If you were to poll our office versus all the other McKesson locations, I would not be surprised if ours was one of the least efficient offices.
Wow. So, thank you for coming, Alexa. A pleasure to have you.
Very nice having you.
You're welcome.
Hey guys.